welcome to another episode of Coffee With. I am your host, Sainabou, and with me in the studio, I have a special guest. This guy is amazing. He's doing amazing things. He's actually making a difference and an impact in Gambia, especially in regards to our health system. So I won't introduce him. I'll let him do that himself. Welcome to the platform, Dr. Ismail.
Thank you, Sainabou. We're really glad to be here. Obviously, I'm a fan of what you're doing as well, too, curating. A pleasure being here.
Thank you very much, Doctor. So tell Coffee With, who was Dr. Ismail Abaji before he became the CEO of Innovorex Global?
Well, a Gambian.
Okay.
It always begins there. I was born in Gambia. I spent part of my childhood in the United States, but came back home, went to Mrs. Ndaus, graduated Mrs. Ndaus, went to Gambia High. I think everybody who goes through schooling in the Gambia, you go through it with an ambition of doing something.
Yeah.
Had the opportunity, obviously, to go back to the States, where I studied chemistry for my first degree, and then transitioned and did my doctor of pharmacy. And worked a little bit as a professional, practice in the U.S. for a while, but going back to where I began as a Gambian, I just felt the need that maybe it was time to start looking towards home. But yeah, very typical. My parents, my dad's from Bansang, my mom's from Afdai Banjul. I was born in Banjul, so I'm proud of that element of who I am.
Nice.
But yeah, that's who I am in a nutshell.
Okay, great. That's very interesting. So what was it like growing up as a young Dr. Ismail Abaji?
It was interesting. So I moved back to Gambia when I was maybe 7, I think 91 or 92. So at that time we were in New York, so I actually could not speak Wolof.
Right.
So when I moved to Mrs. Ndaus, that's when I really got to know Gambia as we know it as home, because up until then home was in New York where we were. So it was interesting. I think I always saw Gambia through the perspective of the people.
Okay.
Which was important. The history that so much of it is our elder people who tell us stories about who we were. Because especially now as I'm older, I've realized that so much young Gambians don't get to know who they are as well too. But very typical childhood in the Gambia, I think, which was really refreshing. I got a chance to experience both public school life and private school life. I think that added layers to my humanity as well to transitioning from Mrs. Ndaus to Gambia High. So it gave me a very diverse set of really good friends that I've kept my whole life. But very typical, everybody plays football,
yeah.
And the regular usual stuff, but yeah.
Okay. So was you a good student, or was you,
Yeah, I was.
You back in school?
I was. I think if you ask my family members, they'll tell you it was almost too easy in a sense that I wasn't the most diligent student who'll study, but I could study all night and pass the exam with flying colors.
Nice.
So yeah, I think academics was an area I did not struggle in at all.
Okay.
But I wasn't limited to that as well too. I always made sure I was very intentional about being active in things that did not have to do with coming first or second.
Okay.
All the time. So I was very involved with a lot of other stuff that did not have to do with, just being a bookworm in that sense.
Well, that sounds interesting.
Yeah.
Good. So now let's talk about your career and your profession. What inspired you to venture into medicine? Because now you're a professional doctor. Are there any other titles that you carry?
No, just a pharmacist. And I like making that emphasis because I think the science is so diverse.
Yeah.
Obviously, I did my undergrad in chemistry. Even in high school, science came natural to me. Chemistry came very natural to me. I fell in love with chemistry in high school, so I pursued it as a degree and did that. And then at that point, a background in chemistry is like a foundation bachelor's degree.
Yeah.
You could go to medical school, or you could go to dental school, or you could go to pharmacy school. I chose the pharmacy school route, one, because I felt like it had a lot of opportunity, especially in Africa. The concept of a doctor of pharmacy is relatively new in Africa and even in the U.S. And if you look at our ecosystem, it's such a huge need in terms of qualified people who know what medications do to people's body, being part of the medical ecosystem. And it has an entrepreneurial element to it. My mom, I'm a third-generation entrepreneur. So it came natural, understanding how to deal with people. So I really fell in love with community pharmacy practice, which is what I spent a lot of my time in the U.S. doing, managing it for companies there. So it was just a natural alignment. I think I could have landed anywhere, but all of us say this is how I ended up there. But I think the life just has a way of putting you in the right position. And I don't regret it. I'm very passionate about the profession, believe in science and medicine. So yeah, it just worked out.
Okay. Yeah. And that's a nice background of, you know, what got you into medicine.
Yeah.
Cool. So now, did you face any challenges in getting to that stage? Because you just mentioned it was just an alignment, so it kind of just happened. But, you know, I'm sure there was like some bumps and bruises on the way. So tell us a bit about that.
Absolutely. I think any immigrant's experience in the Western world, especially when you're going for an educational pursuit, is filled with challenges, right? Because you are one out of a million. So you don't matter in a sense of how important somebody may deem what your dreams are.
Yeah.
And that's what life in the US or life in UK or anywhere is. Gambia is small enough where you're almost one degree away from privilege every single time.
Yeah.
Where in the US you're nobody. All it is a dream that you have, and how you get there, nobody cares. So it comes with challenges, navigating the school systems, paying for education. It costs extremely a lot of money. So typical challenges, but I think the family keeps you grounded on the support system. But challenges that we all go through just to kind of get to where we want to get to in life. I think I'm not immune to that.
Okay. So now tell us about the name of Innovarx Global. What inspired Innovarx? What does it mean?
Yeah, so Innovorex is an innovative solution. That's what Innovorex means. RX is the universal sign for a prescription. A prescription is only a solution, right? So an innovative solution to global health. I was very intentional about choosing that name because I did not want the tone to be like you're setting up a Gambia company or Africa company. Because the moment you say that psychologically, even we do it, we think it's less than. When healthcare is global. And I feel like the solutions we offer here to Gambian people, yes, we were intentional about Gambians being the first to receive it. So it's like a global concept, global idea, but the Gambians receiving it. And so we plan on doing more than just Gambia. So, but that's what that means. It's just a new way of providing solutions to healthcare.
Okay. So now we'll talk about that. So since the inception of Innovarx Global, how has it been getting Gambians to be familiar with the services? Because, you know, we weren't used to having medication being delivered to us, but now that option's available, and obviously having checkups, you know, coming to your doorstep. How has it been like trying to get Gambians to get familiar with that?
I think with anything new, you have different types of consumers. You have the early adopters who like innovative stuff. They see value in it. They run towards it and they experience it. So I think from that perspective, from day one, we've had people who just love the idea. And the rest is education, because I think how we're delivering healthcare causes tension in Gambia. Because now people have to make a choice. Do you want, let's say, a prescription that comes in a plastic bag, or do you want a prescription that has Sainabou's name on it and telling you how to take it? So now you have to make a decision, because that's, I think, quality, not even from a medical standpoint, that's what quality does to the Gambia, which is why it's good. So it's phases. I think we have our early adopters who've been very supportive, but I think the beauty is the company we were 12 months ago is totally different than what we are now, because we've had time to improve the small things to make it better. So every new customer's experience is a whole lot better.
Nice.
But more than anything else, what I'm really proud of is how many grandmothers have assurance. And how many of their grandkids have assurance knowing that somebody is taking care of them. Because at the end of the day, it's not about medicine. It's about how many of our grandmothers are not living to be long enough. So you talk to an average 7-year-old may not know their grandmother because they never met them. The grandmother maybe died at 55 years old from diabetes or hypertension. So when we talk about health, most of the times we focus too much on the health element, but so many of our human stories are dying too soon. And that's why we exist. Healthcare and technology is just the tool we're using, but is myself an example. We moved in 92 back to Gambia. My grandmother died in 94.
Wow.
So I never got to know my grandmother personally. Everything I know about her is through people. But she didn't live to be 60 years old. Right? People in other worlds are living to be 80, 75. Right? So all of that is linked to the health system as well too. So yeah, it's phases. So I think it's been a good year of learning for us.
Okay. I like that. The fact that, you know, this this company is helping get our older parents and our grandparents, that easier accessible solution to getting the right health care and the right medication to whatever problem they have.
Absolutely.
We tend to self-medicate sometimes, and
a little bit too much.
A little bit too much, and then we worry about going and getting checked because we're worried about what they're going to tell us.
Absolutely.
But then I think it's important that you know exactly what you're taking and the dose of it, etc., etc.
Absolutely.
So thank you, Innovarx. We needed you.
Definitely.
So now we're providing an accessible and easy solution for patients. How did this impact society, especially during COVID? Because I know, we had a lockdown and obviously restrictions, but I'm sure the services were easier accessible because of that.
It was, and 2020 has been so interesting, which I think, besides that, most of the times, any idea you have, God puts it there for a reason.
Yeah.
And I say that because when we planned Innovorex, telemedicine, mobile delivery, home health care was part of the design. This was before COVID. So we started, and then COVID happened. And not only Gambia, but the whole world, what they needed was home health, telemedicine services, delivery. So it was like a perfect alignment that we could not predict.
Yeah.
So it almost made the company have to mature faster to meet the demands because of the situation. But I think a lot of the relationships that we have, I'm proud to say that the team were able to be there for a lot of individuals to make sure they could stay at home, get their medications. So now they're not missing their medications, connecting people using technology so that they could speak to doctors all over the world. So just a lot of things have been of tremendous value, which it just, once again, the world just has a very interesting way of working.
Indeed. Because it just seems like if that was anyone, we would be like, oh, did you predict that?
Absolutely.
People would need this kind of service at this particular time, but it all came with the plan that you had for the brand.
And it shows you where healthcare is going. I think we should always, not even healthcare, we should plan things that happen in the country for 10 years down the line.
We should.
Right, so electronic health record system should be universal.
We should,
right?
It should have that.
A patient, you should know what's wrong with you and what's being to kind of mitigate the situation. So, but it's just one of those things.
Okay, I guess we'll get there, right?
Slowly.
Yes.
You're playing your part as well.
Yeah.
To all the industries, we have to just
play
be forward thinking.
Yeah, true. All right, so we're nearly there, but this question is important, and it's your opinion on what needs to be done more in our health service, so healthcare delivery, and obviously just taking things to the next step, so having things electronically. What do you think needs to be done?
No, I think anybody who's heard me speak, I'm passionate about electronic health record systems because I think that is the future of healthcare.
Yeah.
We cannot run away from it. And it democratizes access to healthcare.
Yeah.
I've always felt Gambia, and the reason why we chose Gambia as franchise #1 is actually not because I'm from Gambia, because it's 2.5 million, not even 2.5 million people.
Yeah.
So any good idea, you could replicate it and have global impact.
Yeah.
Right, so I think we should start thinking about, because if you digitalize things, there's more accountability, there's more transparency. So that's one. And then you add elements that the government is already thinking about, universal health record, universal health care, preventative services, making it mandatory. So a lot of different things, but it has to start with building a strong foundation.
True.
And sometimes you have to gut a place and install a strong foundation, then you start building, because I think I'm optimistic.
Yeah.
But electronic health record systems definitely tighter control in terms of more access in the rural areas, because if you don't live in the Senegal, the Serekunda Banjul area, healthcare is worse in the rural areas.
Yeah.
So we have a doctor problem. Gambia doesn't have enough doctors, enough healthcare professionals. So paying healthcare professionals more, enough where they will leave the West and come home because they know you could live better. I think if they paid a lot of doctors, a lot of nurses, they'll come home. So it's like that. Just systemic changes that need just an overhaul of some of the things, because we could be experienced at doing the wrong thing over and over.
That's true.
Yeah.
Because it's a good thing you mentioned paying the doctors and nurses more, because in America and in UK and all other countries, like I know in America you should be able to tell us doctors and nurses get about what, like
they make more per hour than some doctors make a whole month.
Okay.
In Africa, just to give you an idea. That's why most doctors or healthcare professionals who decide to come home, your peers look at you like it's a little bit of insanity to it.
Yeah, yeah.
Right? Because that's the scale, right? Some people make more per hour than healthcare professionals in Africa make in a month. So it's unrealistic.
Yeah.
If same thing with the school system. We can't complain about a school system when you're not incentivizing the best to be here.
True.
So it's just a significantly, they should be the most paid because there's
should.
only one doctor for almost 9,000 Gambians.
That's crazy.
So they should be one of the most valuable people.
And health is such an important element
Absolutely.
of life. Like,
absolutely.
you need to be healthy in order to be wealthy. So if we're not healthy, we don't have the right personnel
Absolutely.
or enough, then there's a problem.
Yes, incentivize and pay them more to even go to the rural areas.
Yeah,
right, as
true.
well too. So it's just little things like that.
So Dr. Ismail, we've spoken about health. We've spoken about why you got into it. Was there anything that you used to do before, before your career as a pharmacist, as a professional? Is there anything you used to do? I remember you used to act. Right?
Yes, extracurricular activities.
Yeah.
Once again, going back to my school, they'll always tell you I was into a lot. I was very athletic, always into sports. So any sport, I'll play it. I still love sports to this day. But more from a leadership standpoint, even in high school, from debates to quiz bowl to acting.
Oh, wow.
All of that, like I did it in high school.
Okay.
Right? Youth advocacy, I was a member of Buffalo at the time. They had a youth advocacy group that used to go up country to speak to rural youth about matters that, issues that matter. Sexual health, reproductive health, certain issues. So that gave me a lot of experience. One, in terms of speaking in public, getting comfortable doing that, but also connecting with people.
Okay.
These are some of the skills that they don't teach you in school.
True.
Soft skills.
Yeah.
And that gave me a lot of opportunities. So obviously in Gambia High, I was head boy in Gambia High. I was chairman of the National Students, Patriotic Students Association at the time, NAPSA. So just things like that don't always have to do with getting an A.
True.
And I think it's important because most people in your professional career don't ask you what your GPA was or what your high school degree was.
Yeah.
But if you're articulate, if you could communicate, soft skills, it puts you far in life. Not that academics is not important, because the sciences, you can't get a doctorate without being academically sound, but just balance.
Okay.
I think balance is important, and also parents supporting balance, supporting kids who are really gifted in music, in sports, and sports more than just football, because there's more sports than just football.
True.
So just balance.
Okay. So it's good you touched on parents supporting, other curriculars apart from, academics. So why do you think parents don't really focus or like to allow their children be what it is they want to be instead of being what they want them to be?
Yeah. I think it's just programming. I think our educational system, the way it was built, was designed, you get good grades, you graduate, you get into a university, you graduate, you get a good job, and then life stops.
Yeah.
And what's interesting is all of that could happen and you're 23 years old with a degree.
Yeah.
What happens next?
Yeah.
How do you develop as a human being? So I think the concept of what success is needs to be rewritten.
Okay.
The concept of what a career is needs to be written so that parents could understand that you could add value to human beings without a degree.
True.
Right? You could create a business. You could teach art. You could be into it. And all of that adds value to the human experience. So it's just programming. There's multiple ways to get where we need to get.
Yeah.
So that has a lot to do with it. But also celebrating people who are non-traditional, successful Gambians who did not go to college, right? Don't have an MBA. I've learned more from business from my own mother, who did not go to college to get an MBA, but she's the most brilliant business person I've ever known.
Nice.
Right? So things like that. I think parents need to understand that there's just more than just a briefcase and a fancy tie.
Yeah, and some of the young people wanting to work in a bank, like all the time, and not knowing that you can work as a carpenter, as a guy that fixes electronics, or as a technical guy,
and make your own money.
And make your own money.
Yes, recession-proof careers. Yeah,
exactly.
Make your own money.
Well, I think like you mentioned earlier, rewriting the maybe curriculum.
Yeah, absolutely.
Because it seems like everything's programmed in a way that they want it to be programmed.
Yeah.
and it's kind of like caging us.
Yeah, but it's a tool, right?
Okay.
It goes back to, this is what our colonial masters gave us.
Right.
There wasn't no research that this is going to work in an African context. We've let go of a lot of things where historically Africans, apprenticeship, you learned, how to do things from your family members, right? So it's just rewriting it.
Okay.
But our generation could do that, because I think we are doing it.
Yeah.
Young, men and women who see you could visualize that, okay, that's creation, because you're creating ideas that last longer. So I think there's a lot of young Gambians who are changing that narrative.
Okay.
We just need to amplify it so that more people could see it.
Nice. Okay.
Yeah.
Okay. So, Doctor, now my favorite question of all questions, which is for you to share your words of wisdom to young people out there, or anyone that's listening that can be inspired from what you have to say.
I think young people need to be very intentional about the future we want to create.
Okay.
And that's with being bold. And this has nothing to do with healthcare. I think we need to activate our creative element and just start creating things that we want for the future. Right? All our countries, Gambia is a very young country. We haven't been around for 100 years. We were independence 1965. So we have to build a Gambia for 2050.
Yeah.
And we can't use 1965 ideas and strategies, because we're going to be left behind. So not that the elderly population are not important. I think they're extremely valuable, but in a different way, from a wisdom standpoint.
Yeah.
Right? Like I tell my father, your job is to make sure I don't make the mistakes that you made.
Right.
Not to paint the picture of the future, because I could see the future, because I'm going to exist in the future.
Yes,
but right?
Yeah.
So it's a balance. But the youth, we just need to be very passionate about the Gambia we want.
Okay.
And create it. Not consume it,
Okay.
but create it.
Okay.
Which is why we're proud to be like, okay, we have 52 Gambians who work for IGH. We're creating it.
Okay.
Most Gambians consume Gambia from non-Gambians. They don't create the Gambia they want. So that's the biggest message.
Okay.
Yeah.
Wow. That's I can say that's a message that I've never gotten on this platform. Because it's like you're quoting the SDGs, and the Africa we want. So we, instead of thinking about the Africa we want, it's about thinking about the Gambia we want, and that goes for all other countries.
Absolutely.
The Ghana we want,
Yeah.
the Senegal we want, the Nigeria we want.
Yeah.
So I think that's an important message to take home. Thank you, Dr. Ismail.
No,
but
thank you.
before we go,
Yes.
like I said, we have a gift for him.
Oh, man.
All of the guests that are coming on the platform from now to the end of the year, they're going to get a free cup and a free pen, courtesy of Tafnaf Printing Agency.
Yes.
Tijan Wada, shout outs to you.
Branding.
Yeah, so
I love it.
you like
Shout out to
branding?
Tijan. I'm
Yes.
such a fan of branding, because it just adds a touch of class to
So
everything.
you're going to get a pen, so this is for you to use
Thank
at work.
you. Oh my
You're
God.
welcome.
Thank you.
And then you get a mug as well for you to drink.
I'm a huge coffee drinker.
Yes,
No cream,
you
no
know.
sugar, but I'm a huge coffee
So
drinker.
this is your cup. Yes, you're welcome.
I appreciate this. Thank
You're
you
welcome.
so much. Yeah.
Oh, I love it. I love
Thank
it.
you.
So that was all we had for you guys in this episode of Coffee With. I'd like to thank my cameraman, Uncle Modu Cisse, for controlling all 3 cameras. That's amazing. Thank my technical team behind the scenes, Uncle Basana, and also Mustafa Sanyang, and I think Shirifu is behind the scenes. I'm not sure. Anyways, but thank you to all you guys, and thank you to my makeup artist, Betty Berry, for making me look this pretty. All right. Bye-bye.
Right.